So some of our guests, when they're on 3+U, make us really sit up straight and watch our posture. Dr. Nick Circolone from Apple Physical Medicine and Rehabilitation, certainly one of those, both of us actually, when they said stand by, scooted ourselves up a bit.
We were very relaxed before that.
We had been lounging a little before. I like the topic you want to address today because it's something that I have learned really through experience to believe in and understand more and more, but sometimes you find out about it the hard way, and that is how interconnected your body is, and that you often see patients come in who have a problem in one part and you find out that the problem starts in a different part of the body. Is that right?
Exactly. A perfect example. You'll have somebody come in and go, I have this bad knee pain. I don't know what's bothering me, and they've been everywhere. I've had surgery on it and it still bothers me. And we find out that this is another area, maybe in the ankle, maybe in the hip, maybe in the low back. What we try to do is find out where the problem is. If it is the knee, let's get the knee fixed. If it is the hip, let's get the hip fixed. If it's the low back, let's fix the low back.
You also are working sometimes on people's shoulders.
Exactly.
That tension can go all the way through.
Well, one of the things is, we know that neck pain can cause shoulder pain. We also know neck pain can cause elbow pain and wrist pain. And a lot of times, let's evaluate what that problem is. And if there's a rotator cuff injury, really, why was that rotator cuff injured? Is it something in the rotator cuff, or is it something in the neck, the nerves being impinged upon, causing the muscles not to function properly?
You just used a perfect word that everyone should always keep in their vocabulary, I think, and that is why.
Yeah.
We don't always ask enough, why is this happening to me? And if you don't know, then you can't address the root problem. You're just treating the symptom, but not the cause.
Why is the biggest question that I ask. If you come into the office, why are you here? What is causing this? Is it really a functional problem? Is it an emotional problem? Is it an environmental problem? What is causing this? Let's get down to the root of this. And we talked about this before. You're going to tell me what's wrong with you if I ask the right questions.
Sometimes, though, Nick, does it take enough visits with somebody, because your relationship with your doctor is just that. It's a relationship, right? So you open up more and more as time goes on. Maybe someone thinks they've been forthcoming. By the third or fourth visit, they realize they forgot to share something with you.
There's a lot of times that'll happen, but I try to bring that out from them in the first visit. We try to make you comfortable. My philosophy, and we've talked about this before, if I touch you, we're going to develop a relationship.
True.
And we want a good relationship. So when we start working there, you're more apt to tell me things than you would maybe going to another doctor. Not that other doctors are bad, of course not. It's sometimes the way things are set up. They'll have their nurse go in first, they'll talk to the patients, then the doctor will come in and ask the same question, and then they'll start doing what they do, is finding out what the diagnosis is, finding out what the problem is.
I think it's important to focus on the name of your practice too. It's Apple Physical Medicine and Rehabilitation. I've heard other people say that you cannot address pain if you're not willing to also rehabilitate it once it's been corrected.
One of the biggest things is, and when we talk about rehabilitation, if somebody comes into the office and they need more than what I offer, we'll send them to PT and I'll say, this is what I want. They have more time to do this. This is where we're going to go. And I monitor that as it goes. I may see them in a week. I may see them in 2 weeks, not 6, 7 weeks down the road, because I want to see how their progress is going. And the physical therapist or the other therapists that we talk to, we actually have a dialogue between us so we know exactly where we want you to be at a certain time.
You also are not unwilling or against pursuing surgery for someone.
Oh, absolutely not. There are certain times when surgery is necessary. And you and I have talked about this just recently. So yes, I'm not opposed to surgery, but let's do things less invasive before we go more invasive.
Back to the questioning of, are you under stress?
No, we're not under stress, are we?
All of us are. But I remember years ago, I lived in Vermont. So it wasn't stress, but it was environmental. It was cold all the time, right? So I was always doing this, and my neck hurt so bad. Oh, yeah. But if you are under a lot of stress, similar thing, you might get a tension headache that then becomes chronic and can spread to other parts of your body. So as part of what you also encourage people is kind of how to change lifestyle.
We really do. We talk about diet and changing things. Personally, my diet at times is bad. I'm just going to be honest with you.
I just ate that hamburger.
Yeah, sugars are terrible for me. My joints hurt after I eat sugars. Sometimes when I eat certain glutens, my joints will start to hurt. So I tell people about this. Stay away from it. Go away from it. See what happens. But, you know, when you talk about environment, you know, not only are you going to see it musculoskeletally, but you'll see it in other ways. High blood pressure, diabetes, all of these things are related to our stressful lives and busyness that we have.
Okay, how about to your point of your joints hurting sometimes when you eat sugar? Is that true for a lot of us, but we don't know it because we've never come off of it to then see how we could feel?
I think so. And that's a great question, because let's take it, if you cut something out of your diet and you feel better, that's what's causing the problem. I have patients that come in the office and I say, okay, I want you to take 3 things. I want you to take a multivitamin, I want you to take a fish oil, and a greens formula. A lot of these people have never touched a vitamin before. They feel wonderful. But God, that was the best thing I've ever taken, Doc. It was awesome. Why? Because you're adding something good into your body. Just if you add something bad to your body, you're going to have that same reaction.
So sometimes people might be afraid that they're going to have to remove things. Often it can simply be an addition of something.
A prime example, I tell certain patients to go off gluten for about 2 weeks. And what'll happen is they'll go, Doc, I can't give up my pasta. I'll die if I give up my pasta. Try it. Well, I can't do it. Okay, and still hurt. I know that sounds cruel, but that's what happens.
Okay, so if someone's watching today, I know your offices are closed on Fridays, but if they've maybe been dealing with, we'll use elbow pain, that they just can't seem to shake, and they've tried different ointments and things, but nothing's targeting it, physical therapy hasn't, come talk to you, and what would the first thing be? For you just to manipulate it and see what you
we need
feel?
to evaluate it and see what's going on. We'll find out, is it coming from your elbow? Is it coming from your shoulder? Is it something you're doing at work with your hands? Are you typing too much at work and causing this repetitive strain, which is affecting your elbow? Are you playing a sport a certain way? You know, we talked about that before. There are certain sports that we play that, you know, I get aches and pains after I play it. Well, if your body's not in balance, you're going to throw it off by playing that certain sport.
Is it hard for people to accept what you say as true? Have we gotten so used to thinking that, well, no, it's this part, therefore this has to be the problem?
Yes.
Is there a reconditioning of our understanding?
For a period of time. And then when I prove to them, this is what we do. Like a great example, and we're going to go to instead of the elbow, let's go to the low back for a quick second. I have patients do a specific exercise when they have back pain. They can't get out of a chair. I have them do one thing and they stand straight up with no pain. And they'll go, well, it's my back that hurts. No, we need to recondition that core. So yes, once I can prove to you that that's not the problem, we come to the root problem. Once I get to the root, then you're going to work on that problem.
Okay, if you want someone who will listen, who asks the question why, and then seeks the answer for it, he's your guy. Dr. Nick Circolone, Apple Physical Medicine and Rehabilitation on Shallowford Road. Office is back open bright and early on Monday morning, 855-7376. The phone number, call them. You will love them. Real people answer the phone, and they're always happy.
Well, thank you.
Thank you.
Thank you.
We're back after this.